Hey everyone, welcome and thank you for joining us today. Again, myself, Shaun Brewster and Bodine Ledden here. We're going to have a chat about a topic that is pretty important for every therapist in the health industry, regardless of your profession. It's something that is rife and not something we're all guilty of, but something we need to be aware of, both from an ethical, financial, and probably moral point of view, which is over-servicing clients. Bo, this is a topic that I think we've probably both seen plenty of evidence of happening around our country in the things that we've seen in our communities. What do you want to talk about here? How should we get started?
Yes, well, I think it's sort of, when we say over-servicing, giving people that they don't necessarily need, as far as overdosing them with the amount of treatments required. And from a professional point of view, you're the expert in the room, the therapist, and saying, well, you need to come and see me for the next 10 weeks twice a week, which is probably not what they need.
No, it's probably not. And you're exactly right in saying that it is a case of doctor knows best, and we are the role of the doctor or the healer or the health professional. And if we have built rapport and we've built trust with that person and we say, you need this, in most cases, the patient will take that as gospel and go, well, all right, if I can afford that and I trust your opinion, then I'm going to do that. But my thing is always, how can you possibly know 10 weeks in advance that they're still going to need what you're providing for them?
Exactly. It's I think it's very much a business mindset rather than putting the patient first. And like any treatment, any person that walks through your doors, you don't really know how they're going to respond after the first treatment. So it's really about, well, look, let's see how you respond, reevaluate, give them a follow-up call. And it's sort of this constant adjustment as we go, and not being reliant on the therapist. As far as a lot of the evidence goes now, we need to make the more patient focused and allowing them to take control, and not necessarily them having the reliance on the therapist.
Definitely, that we're trying to build self-efficacy in our patients, aren't we? We're trying to make sure that they can manage themselves. The other thing is the human body wasn't designed to need our treatments. Like we were designed to function independently of support from external, support, external help. So absolutely, there are times when your body will be in a state of disease or dysfunction or pain, and people like us can come along and kickstart the process of you moving back towards better health, better function, less pain. But to think for even a second that the average human body would need someone like us to maintain health, I think that's a fallacy. And I know there's a lot of health practitioners out there that will probably disagree with us on this. Certain professions have this idea of like a wellness practitioner or health maintenance, and that their patients need them on a regular basis to maintain health. And I think that's a flawed idea, except for in situations where that person might be participating in an activity that pushes them beyond their capacity on a regular basis. For example, we've got elite athletes who are training on the edge of injury at all times. They're pushing that boundary. Now, they'll occasionally train a little bit harder than they should and not recover as well as they should. And some treatment might be useful in the management of their performance. But for your average person who is, suffering from sore back, sore neck, migraines, headaches, whatever it might be, to think that they should have to have something like this on a regular basis or for long periods of time doesn't really do them justice. It doesn't serve their best interests, I don't believe, anyway.
Yeah, definitely. There's a lot of reliance there, and it creates far more barriers as well. If we think about that from a psychological point of view, that, well, I can't do this because if I don't see my therapist this week, then I'm not going to be able to work the following day, or then I'm going to have more higher chance of injuring myself or making it worse. So there's a lot of fear avoidance. There's much more hypervigilance around their behavior, their exercise. So we should be doing the opposite and empowering them and, not having them rely on us, giving them the confidence to go about their daily life and activities, sport, exercise, whatever it may be, but be more of a coach and guide them. Not saying that you have to see me this many times per week, or even, look at selling people packages, for example.
Right. Yeah. And that's a real trap, isn't it? And I think that there's the package thing, which is where, for those who don't know what we mean, it's, you come in for your first treatment and the therapist says, look, if you could come back regularly now for the next 6 or 8 or 12 weeks, you want to come in once a week, it's going to be this much money, or you pay up front. Let's say your treatments are $100 and you want 10 weeks for the treatments. Well, rather than spend $1,000, let's give it to you for $950 or $900, and you'll save some money. And for the patient who's looking at that big number and going, oh, $1,000, I don't know whether I can afford that. Let's look at that $900 one and pay it off in installments. It's very marketing driven. It's very business driven. It's not really outcome driven for the patient. And I've met plenty of people, in fact, good friends of mine, who have gone to see health practitioners and been sold into one of these packages and spent thousands of dollars up front, and found after 2 or 3 sessions that, one, they weren't getting any results, and two, the health practitioner wasn't really moving them forward with a plan. They were just doing the same thing week after week, hoping to get a result. And, that's a classic sign of a scam, I would say.
Yeah. And Shaun, when we look at that progression of treatment, that pain has a high emotional connection to it. So we're sort of using that. If you are selling packages, it's sort of like saying, well, if you don't do these 10 treatments, then your pain is less likely to get better. So you mentioned before the ethics. So that could be a significant implication there, being unethical. But what about from a compliance point of view, as far as health funds and associations go?
Good point. I deal quite a bit with health funds in my work in an association, and we know for a fact that the health funds requirement of compliance for health practitioners is that there is a treatment plan, and that there is regular assessment within that, which means that if you have a treatment plan that says, okay, I think I'm going to need to see this person 6 times, and that might be the case in some cases, there'll be some conditions where, it takes a little while to get there, and as part of that journey, you can hold the hand of that practitioner, of that patient, move them through that journey, support them, and adjust the treatment as needed, and that's reasonable. But what if you get to week 2 and they are 50% better than you expected them to be? Or what if you get to week 3 and a comorbidity has arisen, or some other kind of factor has come up, and so it might mean that you need to give them a rest from treatment for a couple of weeks, or you might need to go to 2 sessions in a week. You can't know that unless you're doing the assessment in an ongoing way, both at the start and end of every session, and probably throughout. And so a compliance issue for health funds is that, yes, you are doing regular assessment, and you're not forcing someone into a commitment that is beyond what the actual presentation requires.
Yeah, and I think it's important to understand that certain prognosis and how long things typically take. If you think, for example, an acute disc injury, we know that it takes 3 to 4 months for that to resolve and symptoms to really improve. But that doesn't mean that we need to say that I need to see you every week for the next 3 months. But we could give them the understanding, look, this usually takes 12 weeks to, plus or minus a few weeks here and there. In that time, let's see how you go over the next few weeks. Then, like you said, extend that out, and then you're in control. You want to then be educating them on exercise and movement and lifestyle changes and all of these other factors that are associated with it, not just come back so I can massage or mobilize you every week. Otherwise, it will get worse, because that, again, creates that psychological barrier for that person. So yeah, giving a guideline of how long things can take, but not having a rigid structure as how many sessions per week they need from the get-go.
That's right. And to build on that idea, we have an understanding in our health professions that different tissues heal at different speeds. Nerves are going to be slower than than a tendon by a long shot, and a tendon will be slower than a muscle, and so on and so forth. So while they are healing rates that we can kind of predict in most cases, there's a lot of factors that will influence that. And those healing rates will happen regardless of our input. Muscle, tendon, bone, ligament, everything kind of heals naturally through the body and its normal processes. Now, if we come along and treat that person every week, will that necessarily speed up the healing rates of those tissues? Maybe, sometimes, some situations, but not all of them. In fact, it may even impede it if the treatment that you're applying is not appropriate for the person. But absolutely what you're saying before about the psychosomatic influences of these timelines, you give someone, it's going to take you 10 to 12 weeks of treatment before you're better. That sets them up for the expectation that it'll be 10 to 12 weeks. And it may, if you had have said to them, it'll be 4 to 6 weeks and you'll be 80% better, which may very well be the case, you probably guarantee that's what'll happen as well. And so whatever you kind of tell them, the brain kind of gets into the gear of that, and then the body will do what it's going to do, but the brain may actually be holding them back. Yeah. Not from a conscious point of view, but from a subconscious input that you've given them with that timeline.
Yeah, and so for example, you go through your 10-week program, your 10-week sessions, whatever, and I was going to see you, and I would think, well, Shaun couldn't make me better in 10 weeks. My pain must be so bad. It must be the worst type of injury. How am I supposed to get out of this if the best person couldn't make me better? And then, so that's a descending spiral where it was sort of, oh, what do I do now? I'm helpless. I'm hopeless. I've got nothing left. And then, or do we have to do another round of 10 sessions? And, that would be certainly unethical. When someone's not progressing with their treatment, you think, all right, well, let's do another round of it and see how you go. And if you pay up front, you're going to save a bit of money. So, the financial implications when we look at a biopsychosocial model, well, that's a contributor as well. So we've got to factor all of this sort of stuff into our treatment, but it realistically should be a week by week assessment. How are they, or whenever they're coming in, fortnightly, monthly, how are you presenting? How's the last few days been? What are you aiming to do to get better? What are you doing for yourself? All of this sort of stuff. So it should be more of a running treatment plan, not a start and finish.
Yeah, it's unethical to make the patient reliant on us, is really the upshot of it, isn't it? If they're relying on us and the timeline that we've created for them and the treatment plan that we've created for them, that's not right. It's not ethical. It's not fair. We really try to build that, like I said before, the self-efficacy for our patients. The treatment should be 10% what happens in the treatment room, and 90% is the advice and the guidance and the structure that you build around that for them to take home and go, right, here's what I can do on a daily basis. Here's the things I should avoid. Here's the things I should do more of. Here's the way I should sleep, move, eat, all those things to support that healing process. And to think that we can magically make someone better in a nicely defined square box of 10 sessions is just ludicrous to think that's.
Or if you upgrade and pay an extra $50 a week, then you can get better 4 weeks earlier.
It's crazy, isn't it? And then there's the other side of that, which is sort of over-servicing clients based on their needs, or their request. So I've seen this with patients of mine where, particularly those with chronic pain, they'll say, can I come and see you twice a week instead of once a week? Or can I see you more often? Or can I, they're trying to get more of your time, thinking that will get them better faster. We've got an obligation to be honest with our patients. We have an obligation to give the best possible service based on their needs, not the presentation they have. It can't be for everyone with patellofemoral syndrome, you give them this many sessions and this much time. It can't be for everyone with low back pain that you go, you need this many sessions, because we know there's 1,000 variables that come with every person that walks through the door. And so patients will ask for more time from us, or should I come back more often, or should I see you more regularly? And the answer will be, or should be, I believe, let's see how your body responds. If you're not getting better, you should see me less. We need to find someone else, because if you aren't getting results, that's my fault, because I either haven't guided you correctly, or I haven't provided the right treatment, or I haven't given you the right advice. But let's find someone who can do that for you, because I don't want to waste your time or your money.
Yeah, it'd be more time with me doesn't mean that you're going to be better. The more that I push and press and move you doesn't mean that you're going to be better in a short amount of period. Having that conversation and that full consultation and understanding what other factors may be involved. And yeah, you might need to pull in another practitioner who's good with exercise. You might need to pull in a psychologist who's good at addressing those factors. It really should be a multimodal approach, with pain being so multi-dimensional. But Shaun, I think, people might say, well, I have to get a certain number of bookings per week. So some people might be, from a therapist point of view, be trapped between a rock and a hard place. How do you think we could overcome that?
I'm not right, and I say this a lot, that there's a metric-driven approach to treatment numbers. The employer is telling their employees, we need to see you rebooking 70, 80, 90, 95% of your clients. We want to see them booking in again. And I guess we've got to kind of ask the question, what kind of clinic are we working in? If you're a therapist, as in you are providing a therapy that resolves a problem, then to be driven by rebooking rates, again, is unethical, in my opinion, at least. And I see this quite a bit in physio, osteo, allied health professions, where they are absolutely bound by their ethics from APRA law, and that they should never be straying outside that, but it still happens. We want to see you rebooking your clients. And it's a tricky one, because, if that's what your boss is telling you to do and you want to get a paycheck at the end of the week, there's a fairly high motivation for you to do that. The other side of that is, of course, are you providing the best service for the patient? I think in some cases, there is absolutely a need to rebook patients. You'll know that person will get better sooner if you can guide them, right? And there'll be some patients that will need more guidance, more hand-holding than others. My issue is when you're trying to rebook every single person that comes through the door, because not every single person that comes through the door needs you or needs to see you more often. That's where we get stuck.
Same thing.
Right.
You're rebooking them for the same treatment rather than, well, next week we're going to be in the gym, or, whatever it may be. So there's some form of progression there.
Yeah, there has to be progression, and the progression should always have an end point. If the employer turned around and said, we want to see you rebook every patient 3 times, because with our clinical reasoning within that 3 sessions, we can see an assessment session, we can see a really good, robust treatment planning session, and we can see a let's get you on with your life kind of session. That kind of makes sense. That's kind of one big treatment broken into 3 chunks. But when you're trying to book every patient every time into the next session, this is where we get stuck, both from an ethical and legal perspective. It's not health fund compliant. I can promise you it's not. It's not going to be in alignment with the constitution of your association. It absolutely won't be. And it's not going to be in the best interest of the patient. So it's a tricky one, this over-servicing, both from the perspective of the therapist looking for the money, over-servicing from the perspective of the therapist who thinks they have the answer for everything and that answer will fit nicely into 10 sessions. That's crazy. Or over-servicing from the perspective of the patient wants to see more of you, or your employer thinks that you need to see them more often. There's so many things. We're torn, right? Every practice is going to be torn.
It'd be like someone walks through the door with bony bruising and you go, well, 12 sessions once a week and I guarantee you'll be better. Well, we know that bony bruising can heal within 12 weeks. So
yeah, that's right.
Like fitting it into that box, which is, it is a real challenge, particularly when you've got commission structures as well. If you hit a certain number of clients or rebooking, you're going to get an additional 10, 15% per week. It's really that sort of, again, rock in a hard place between what the evidence and the research says and the ethics would say versus that financial income and what the business wants you to do.
Definitely. And this is a great thing to recognize as a health practitioner, is that our patients, for the most part, if they've spent any time with practitioners like us, as any considerable amount of time, they'll come in expecting you to try to rebook them most of the time, right? That's what they're used to. And I always do this with my patients now, is that when they get to the end of the session, they say, when should I come and see you again? And I'd say, well, hopefully never. Hopefully I've fixed you today or set you on the right path towards a better situation. That may or may not happen, but let's look at some assessment things that we can put in place to determine whether you need to come back, or whether I'm the right person for you, or whether you need to go and see someone else. In an ideal world, I'd see every patient once. That'd be it. And I'd do a great job and they'd send me a new patient the next week. That'd be the perfect world. But we know it doesn't work that way.
Yeah. How long is it going to take me to give you the tools that you need to manage your own symptoms?
I'd put it. Yeah, exactly. Rather, be driven by the outcomes of each individual session, rather than be driven by, what kind of structure I could kind of put around it from the start to see how long I can draw this out for.
Yeah.
No, it's something we all need to be really careful of, and I hope that everyone that's listening or watching this has a bit of a think about this, because it's something that so many of us do, I think, automatically without realizing, because we were either taught it at school or taught by an employer that this is how these things work. And a true health practitioner should really be working towards making working towards creating a situation where your patient doesn't need you. Like, they've just got the skills, the knowledge, and the understanding to do it themselves. That's a really skilled health practitioner when they can do that.
Yeah, that educating them, giving them the tools, giving them the confidence to be able to self-manage is massive. And like you said, then they'll be recommending many other people. I only need to see Shaun once or twice, and that was fantastic. Then more people are going to come from their referrals. So you still get a lot of patients coming through, but it just means that you're seeing many more different presentations and you're expanding your client base, rather than seeing the same 20, 25 patients per week, however many you see, with the same things, doing the same treatment.
Yeah, and I think most people would be surprised to see that those ones that you do kind of push out the door rather than keep inside, they'll come back and see you more regularly anyway, because they know that they're not going to get sucked into another 10-week program or plan or something. They'll come back when they need you rather than when you want them there. And that's a huge thing. And look, I'll just say one more thing before I wrap up, which is, I know that there's probably a lot of people listening going, but I see Mary every week. She's got arthritic low back pain, and her knees are sore. And if she doesn't come and see me, then her back and her knees ache. And I'm the only thing kind of keeping her going. There's so many situations like that. And our patients do become reliant on us to keep them moving. And I think there's value in providing that input where required. But at the same time, if the intention behind that treatment isn't to get them unreliant on us, that's where the mistake is made. Like, we have to be working towards, what else can this person do to not need me? And if we're always thinking like that, and then providing support where required, I think that's a reasonable way forward too.
Yeah, like that treatment might support their reduction in pain in combination with other things, but it's not that you need my treatment to get you through the next week.
Yeah, that's the mistake that people make. Absolutely. Yeah. Great. It's a big topic, that one, Bo. We wrap it up there. Plenty of things for people to think about. And if anyone's got any questions or comments, please send them through. We'd love to chat about this. It's a good one.
Absolutely.
Cheers. Thanks, everyone.